Good evening and welcome to another edition of Money Talk with Melanie. I'm your business diva, Melanie Collette, broadcasting live from beautiful Cape May County, New Jersey. And for those of you who keep up with politics, from Legislative District 1, where we where we flipped the seat this past election, a Senate seat in our assembly. So I'm very excited about that. So I feel like I need to lead with that. And I'm proud of that way down here in Cape May County, we were able to do that in a blue state such as New Jersey. But I'm broadcasting via SHR Media, streaming live on Facebook. And welcome back, folks. I'm so glad to be back on the air. My guest today is Peter Pitts. He's an author and president of the Center for Medicine and Public Interest. And we're going to talk today about common sense healthcare. I know it's been in the news a lot, especially with 2020 coming up. So I am very excited to have him on the show today. He's very knowledgeable about the topic, and I'm just happy to be here. There is, for those of you who do not know, that tonight or today, President Trump started I think it's called the Black Voices Coalition. Today, I was invited to that, but I wasn't able to go. And so I wanted to give a shout out to everybody who was able to attend that wonderful event. I hope you guys are having a fantastic time. It's a good time to be a Republican. I'm just saying. Albeit, not very popular thing to be for some reason. It's a good time right now to be a brown Republican, and especially in my district on the local level. Not that you guys care, but I'm going to tell you anyways, because I want you to know where I've been. I also worked on the local race in addition to the assembly race, where we had the first African-American assemblyman in Legislative District 1. And I also worked on a local campaign where we turned our entire our entire municipal council red for the first time in history. So that is just an amazing feat. And our candidate, Jim Norris, worked very hard, as well as our legislative candidates. And you probably have seen bits and pieces about Antoine McClellan, who's the first African-American assemblyman in this particular district, who's a Republican. And they all just worked very hard. And I wanted to give them a shout out and congratulate them because they killed it. LD1, Mike Testa, with Mike Testa leading the ticket, our freeholders, which we're probably the rare people who have freeholders, but we have freeholders. You can look up what that is. And our assemblymen and our local people, we just killed it. And I'm very proud. So I had to give a shout out to all of you guys who got elected and put your hat in the ring. Did a fantastic job. Now, that said, in the Money Talk news, but I want to give a shout out to people in the Facey chat. Alexander Bland, hi. I know we have to meet soon. President, youngest president in New Jersey history of the NAACP, Alexander Bland, is in the Facey chat. Kevin Martin, how you doing? John Campbell, how are you? Good to see you. Thank you for being here. And Money Talk news, let's talk a little bit about what's going on in the news. The CEO of The Gap is leaving. I don't know, those of you who shop at the Gap might be concerned about that, but he's stepping down after what's described as a challenging quarter. I don't know if I'm too concerned about that. The Gap has been making a lot of changes. They also own Banana Republic and Old Navy as under their control. Let's see what else. The Saudis are investing in cloud kitchens, according to the Wall Street Journal. The former CEO from Uber, Travis Kalanick, has raised $40 million for this new startup from Saudi Arabia. That's interesting. And it's one of Uber's largest backers, which I didn't know. This is according to the Wall Street Journal. For those of you who did not know, Sears, and who also owns Kmart, are closing more stores. I'm going to be honest, didn't know that Sears was still open. There's like one Kmart not too far from where I live that somebody posted the other day that it was closing. And I'm thinking to myself, I didn't know it was still open, quite honestly. But Sears is closing more stores. which is unfortunate. I wanted to make sure that I got to this story. If you guys have never heard of a Juul, Juul, that's probably because you're not around a lot of teenagers. They have been in a lot of trouble lately because they're accused of marketing their product to teens. And if you don't know what a Juul is a like an electronic smoking thing. They use Juuls to teenagers mostly. Adults do too, but it's like an e-cigarette, and you can use it to smoke marijuana. You can use it to smoke these different flavored things, which is just, it's crazy. And as somebody who works with teens on a regular basis, I can tell you it's building up a serious addiction problem. It's the same thing basically as smoking. If you've never smoked before, it's actually almost worse. But Juul is finally pulling their mint flavor after they pulled a whole bunch of other flavors. Now, it just so happens that this past a few days ago, I had a professional development about Juuls and about how teens use them. And I didn't know that there were over 15,000 flavors of Juuls that they had. They come with these pods. I learned more about e-cigarettes and smoking than I wanted to, but apparently they come in all these different flavors, 15,000 flavors, and flavors like gummy bear. And I used to think to myself when they said, they're marketing stuff to kids, I used to think that was kind of a crock. But after this seminar that I sat through, I was like, wow, they really were marketing to kids. Now, my only other issue, we have middle schoolers that are smoking Juuls and things like that. My only other issue is from a parenting perspective, but they talked about all the different ways that kids are hiding their Juuls from their parents, like ordering it online. They're buying, here's the how they're slick. And I want to get this message out to parents and check on your kids. What they're doing is they're buying debit cards from like Wawa or wherever, right? Then they are putting money on them. And I guess if they have like a little job or whatever, they can put money on them. They're buying those debit cards, and then they are ordering them online and having them delivered to like their back door. Like they'll put the special delivery instructions and have them delivered to the back door. And of course, kids get home before their parents do, and they'll just get to them before their parents do. And that's how they're smoking this stuff. It's really quite amazing. Like I never thought of, and I guess, kids are sneaky in general. Teenagers are. So I guess I shouldn't be all that surprised, but they were telling the story about how these kids smoke these things. And I think from a business perspective, I think Juul is in a lot of trouble. The other thing that's in the news today, I wanted to squeeze this in before the break, is that older workers are delaying retirement. And apparently millennials are upset about it because they're like, move out the way, old people. We can't get promoted because you guys aren't retiring. But that's according to a new survey that they're upset about that. So I found that interesting. But I think that, baby boomers are finding it more and more difficult to retire. And I'm sure that's the problem. So you're listening to Money Talk with Melanie. I'm your business diva, Melanie Collette, broadcasting live from Cape May County via SHR Media. We'll be back in a few minutes.
Right now, you can get the credit you deserve. Just visit MrCreditRepair.biz. Let their expert credit repair specialist remove late payments, charge-offs, collections, even old bankruptcies, fast and easy. That's MrCreditRepair.biz. Why go anyplace else? Increase your credit score today. At Mr. Credit, you always get a quality service, all at our everyday discounted price. Stop getting turned down for cars, credit cards, or even new homes. Visit MrCreditRepair.biz today. That's MrCreditRepair.biz. Your credit repair is our number one priority.
Making a living can be tough these days with so many jobs going overseas. If you love numbers and puzzles and want job security, you can become a tax specialist. With an amazing 6-month tax course from Tax Mama, operate your own tax practice locally or anywhere in the world where there are American taxpayers. It's a great way to write off your trips to visit family for months at a time. Everything you need to pass the IRS 3 special enrollment examinations is included in this course. Visit irsexams.school. And if you need more than 6 months, that's okay. Take your time. You're in the course until you pass the exams or until you unsubscribe and reject Tax Mama's emails.
Conservative media done right. SHR Media Network.
Welcome back. You're listening to Money Talk with Melanie. I'm your business diva, Melanie Collette, coming to you via SHR Media and broadcasting live from beautiful Cape May, New Jersey. For those of you who don't know where Cape May, New Jersey is, it is right in the peninsula of New Jersey. Like people say South Jersey is like Trenton, and I'm like, no, it's not. It's not. It is actually Cape May, which is very close to Delaware. That is the real South Jersey, as I like to refer to it. But anyway, without further ado, I want to introduce my guest, who is Peter Pitts today. And a little bit about him. He's the president and co-founder of the Center for Medicine in the Public Interest and a visiting professor at the University of Paris's Descartes Medical School. I'm sure I said that wrong. From 2002 to 2004, Peter was FDA's Associate Commissioner for External Relations, serving as Senior Communications and Policy Advisor to the Commissioner. He also supervised the FDA's Office of Public Affairs, Office of the Ombudsman, Office of Special Health Issues, Office of Executive Secretariat, and Advisory Committee Oversight and Management. He served on the agency's Obesity Working Group and Counterfeit Drug Task Force as well. In addition, he served as an adjunct professor at Indiana University School of Public and Environmental Affairs and Butler University. So without further ado, Mr. Peter Pitts.
Thanks for the kind introduction. I'm sure my mother-in-law is smiling somewhere.
Well, thank you for being here. Is there anything that I left out of your bio that you wanted to share with the audience?
Oh, it's not really about me. It's about the topic. So I'll just say thanks and let's press on.
Absolutely. I'd love to press on. I think one of the first things that I know I want to talk about, because it's been in the news so much, and because we're watching especially the Democrat candidates talk about Medicare for all. I'd love to talk about whether or not something like Medicare for all would actually work, which is really socialized medicine, in my opinion. And what your opinion is on that?
You know, Medicare for all means different people. I'm all for a public option. If people want to buy into Medicare or Medicare at a certain age, I think that's fine. Problem is that the government can sell a policy, nationally and recognize the economy of scale, while private insurance companies go state by state. So, the policy that I have for my family in New York, that same exact policy in Idaho or California or Kansas or Oklahoma or Georgia might be more expensive or less expensive. So I think that to level the playing field, if the government wants to sell a policy across the country, so too should private insurance companies be allowed to do that. And I think the real, the talking point here is that people deserve to have as many options as are available to make their own choices. I think people have the best opportunity to make the right choices to choose for themselves, rather than having Uncle Sam kind of become Uncle Sam MD.
It seems to me that they could possibly accomplish the same goal, but not really, because the government really has different goals. But it seems to me that they could accomplish the same thing if they did away, if they allowed us to sell across state lines.
Sure, and that's certainly one of the ways to get there. Because what you want to do is have people have options. And for example, one of the big issues in healthcare is to have healthy young people in the insurance pool. And obviously, under the Affordable Care Act, we tried to have a penalty if they didn't, and that didn't work out because the penalty was less expensive than buying insurance once you needed it. People figured it out pretty fast. But you want to allow, for example, healthy young people to buy stripped-down policies, like, for example, only offer catastrophic care. That's a good way to, get them into the market in the first place, and once they're in the marketplace, it's value. I think that when you rely on the free market and people's intelligence, it generally work a lot better than trying to have the government design programs for people and then kind of coerce them in a way into those programs.
Exactly. And to me, that especially as a, for a full disclosure, I'm an insurance broker. I do life insurance. So, and one of the things that I like about being a broker is kind of the same principle. One of the things that I like is that I don't have to sell for one particular insurance company. I can sell for any insurance company that I want, and I can have the insurance fit the client rather than having to squeeze the client into one particular company. If I was, go ahead. I'm sorry.
When I was in government, I helped to design the Medicare Part D drug benefit for seniors. And a lot of people in Washington said, well, that'll never work. Seniors couldn't possibly make the proper choice for themselves. And they turned out to be exactly wrong. You have to take people, and the market economics work when you allow the government, rather than working against the private sector, work with the private sector. And that's exactly what Medicare Part D is. It's a partnership between government and private insurance companies. And it's a perfect certainly not. But seniors, you generally give it a 95% plus rating, and the cost of funding way below what we expected to originally. So again, when you look for allies rather than adversaries, things generally work out better.
I agree with you. And I think that, especially working with the older folks, a lot of them just need to be informed and just need things explained to them.
That's right. And the government did a very nice job stepping up relative to educating seniors on the party drug benefit as the private companies, because, it's true. The educated consumer really is everybody's best customer. And when you take the time to walk people through their options and their needs, they generally make the right choice. And at the end of the day, if they make the wrong choice or if their conditions change, they can change it during open enrollment period. Right.
But again, that's something that has to be, that's something that has to be explained to people. But
exactly right. One thing that has to be explained to people is that, there's no such thing as free healthcare. You pay for it one way or the other. Just speaking for myself, I'd rather be able to pay for healthcare programs that I choose myself, how you pay for it through taxes, and have somebody in DC make my choices for me. That generally is not the best solution for anybody.
No, it really isn't. It really isn't. I completely agree with that. I mean, I don't understand. And I would love to have somebody, if there's anybody on the Facey chat that agrees with Medicare for All and would like to chime in on how in the world you think that would work out. I think that there's two plans that are out. I think Bernie Sanders' plan is out, and I believe Elizabeth Warren's plan is out. And I think Elizabeth Warren's plan costs like $53 trillion or something. So some ridiculous, outrageous number that you couldn't possibly have, all the richest people in the world pay for. Even if all the richest people in the world in the United States paid up all their money, you still would not be able to support that program.
That's right. I don't agree with saying everyone's program, but I give her a lot of bonus points for being very honest about exactly what she's going to do. One thing that she's not really transparent about is that when you have a single-payer government-run healthcare program, what goes along with the taxes that you have to pay and the lack of the ability to buy private insurance is rational, because the government makes choices, and sometimes those choices don't give you what you want, and now you won't even have the opportunity to get that by reaching into your own pocket. And I think that once people begin to understand that it's a one-size-fits-all proposition that doesn't really fit anybody all that well, they're going to frown on it, and it's almost in many respects, as a lot of newspapers have been talking about, close to political harakiri from Senator Warren to really push the second proposition.
It is. You wonder, and apparently her numbers, frankly, have been slipping ever since she kind of revealed a little bit of, what the cost is going to be. But we haven't begun to talk about the rationing that takes place. Other countries that have this, that are, by the way, have much smaller populations than the United States has, are doing rationing.
That's right. Now, also, many countries that have a single-payer system. Like, for example, in England, the fastest growing sector of the English healthcare system is private insurance. So, clearly other countries are thinking about more of a hybrid system that the government pay and private pay. So we should actually look at what's happening right now in reality, which is kind of a fantasy land is what we want it to be.
I mean, they are having, from what I've been reading, they're having things like, people who have, some of the most basic kind of illnesses and things, at least things that are considered basic over here. They are giving people the option to kill themselves instead of, being able to take care of them. They're giving them the option to go ahead.
So, we have to be honest. One of the other discussion points, certainly during the Democratic debates is the price of pharmaceuticals. Because people say to me all the time, why are drugs so much less expensive in Europe and Canada than they are in the U.S.? And the truth is not always as clear. 90% of the drugs used in the U.S. by volume are generic drugs, and generic drugs are less expensive in the U.S. than Europe and Canada. And the temperatures that give you this 1,000 yards clear, they can't possibly believe it. Then when you ask people what percent of the American healthcare spend is on pharmaceuticals, they generally go 40, 50, 60, 80%, and the truth is 11.7%. So, the issues that the candidates are railing on, aren't generally presented in a truthful manner. And my new book is called Common Sense Healthcare Policy for Common Sense Americans, because when you actually look at the facts, you recognize a lot of things. One of the things you recognize pretty quickly is that there really are no easy answers to these questions. It's complicated. Solutions take a long time. It requires allies rather than adversaries. That healthcare really is an ecosystem that you have to understand all the individual parts of how they fit together. You can't solve the healthcare debate during a 3-minute soundbite. It does not work that way.
Now, that's something that's very plain and truthful that people don't want to talk about. You can't even solve or even explain the complexities of anybody's healthcare program over a debate over an hour. You can't.
That's right. What you really need to understand too is you don't want to in any way disempower patients and physicians and caregivers. I'm a former federal official. I believe the federal government does lots of fabulous things. Micromanage people's lives is certainly not one of them, nor should be.
Oh, now that's an interesting point that that you don't hear about at all.
Well, when you ask people, the overwhelming majority of Americans have health care either through their jobs or they buy personally. And when you say we're going to take that away from you and replace it with something that the government's going to provide, whether or not you love Donald Trump or hate Donald Trump, that's the thing most people are going to look at and really raise their eyebrows. People don't like things taken away. You don't want the government telling them how to run their lives. And again, I think if you want to have a public option for people to buy into, you have that. I think it requires a rejiggering of how insurance is played in the country from state to federal. But that's a small fix, and I think it's worth testing out. When you run something huge like completely eliminating private insurance and letting Uncle Sam build up a brand new huge federal bureaucracy largely through taxes, I don't think people are going to buy it. And I think as you mentioned earlier, the hit that Senator Warren is taking the polls reflects that.
No, I think it certainly does. Now, one of the things that you talk about is the need to strengthen patents and intellectual property protection so that we can protect sustainable innovation in healthcare technologies, such as new medicines for killer diseases. I'd love for you to talk about that, because that's certainly something that we've been talking about as far as the tariffs and our intellectual property being stolen. But quite frankly, I never thought about that as far as the healthcare technologies are concerned.
Sure. Over the last 50 years, the average lifespan of the American male has increased by 10 years. That's a really amazing number. And, that's largely due to our ability to really, aggressively counter cardiovascular disease and other chronic diseases through new pharmaceuticals, through innovation in pharmaceuticals. And unless you protect patents and intellectual property rights, companies and investors don't want to invest in these very high-risk propositions. So I'm sure we all know, don't invest in the government, the drugs at NIH and the drug companies spend lots. And that's just not true. Government plays a very important role in academic research. That shouldn't be underestimated. But they shouldn't have the majority of the work here. And if you look at other countries, they don't aggressively provide new innovative drugs for populations. Certainly in certain types of cancer, breast cancer is a good example as well. good as ours. And you want people to have the opportunity to have the drugs that the doctors want to give them. And clearly that represents a problem as well as an opportunity relative to cost. But the solution isn't to, say we have enough drugs, we don't need any more, or to try to nationalize the proposition. Those are simplistic answers. There's a saying that says that for every complex problem with a simple solution, that's wrong. And I think that's tailor fit for political debates. People don't like to talk about the partnerships and long-term solutions and diet and exercise and personal responsibility. They talk about kind of fantasy solutions like drugs from Canada that simply is a non-starter. So when you have to look at the whole healthcare ecosystem and how to really address it, innovation in pharmaceuticals all of a sudden looks very attractive because it keeps people out of the hospital. That's really what the majority of the healthcare dollars are spent right now is when people hit the hospital. So if we can keep people out even for weeks and months, it can save a tremendous amount of money, and that's directly due to the American system of intellectual property laws.
There's a lot of talk about R&D and the cost of research and development with different pharmaceutical companies, and whether or not that I think that's the defense of pharmaceutical companies a lot of times is we need a lot of money for research and development, but sometimes the conflict is whether or not they're really just profit taking or whether they're using it for research and development. And I'm always conflicted with that. I'm like, they do need a fair amount of money for research and development. But what I hear you saying is that they are doing that and that the proof is in the survival rates that we have here in the United States.
The success rate of drugs that reach the FDA are only 2 in 10. And the overwhelming amount of drugs that are researched don't even make it to that stage. So it's a high-risk proposition. And you have to factor in the cost of research and development. And I'm not saying that failed research is unimportant. It's extremely important. We learn lots of things from it. But you have to amortize that into the overall price of the products. And, the other issue is people say my drugs are too expensive. What they generally mean is my copay at the pharmacy is too expensive. And that's not only a factor of the pharmaceutical developers, it's a factor of insurance companies and prescription benefit managers who are, in many respects, to your point, gouging the system. That's got to be addressed. It's got to be addressed aggressively.
It does need to be addressed. How do you suggest that be addressed aggressively? Do you have any suggestions? Like if you were an advisor for, I don't know, one of President Trump's advisory boards, do you have any suggestions on how to work on that?
Well, there are lots of ways to get at it. I think the first way is to be transparent and let the American public know exactly where all the money is going. Because when you see that, you see how a lot of these public companies are backing themselves at the public's expense without really bringing any added value to patient therapeutic outcomes. You begin to wonder, why is that so? And, if they don't want to do the right thing themselves, is it the role of government to step in and try to make them be able to play fair with the public health?
Exactly. That's true. That's a good way. And I feel like President Trump is kind of working in that direction, and that the pharmaceutical lobbies are not very happy with him because of it.
Well, anybody that's going to poke around and try to make the place fair and make a fair profit versus a huge profit, those are going to be smiled upon. But at the end of the day, people need to have broader access to high quality care, and that begins with having a fair price at the pharmacy. And that's as much an issue for the pharmaceutical companies as it is for the insurance companies and other kind of intermediaries who skim money off the top and don't make patients any better of their own volition.
Now, you talk a bit about the different federal agencies, such as the CDC and the FDA, and having them work a little bit better and be a little more balanced. What do you mean by that?
The most important thing is the win here is to bring new medical technologies to market faster and more safely, and that is now more possible than ever been before because of new types of science and artificial intelligence. And it's not just about gathering information, so understanding how to use that information and making sure doctors and nurses and pharmacists understand exactly what's going on so they can also offer patients better understanding of the medical program that they're using. But also from a personal responsibility perspective, patients have to relax their diet and exercise. It sounds pretty, but it's true. You need to medicines as prescribed. Most people don't. And, we all be pulling together in the same direction. There's no one party to blame. Not any single party can fix the problem. We've all got to do it together.
True. Do you have any insights as far as, because you've worked for many of these government agencies, and there are a fair amount of conspiracy theories, if you will, out there about, for example, the FDA and whether or not they block holistic medicines and natural alternatives, whether or not they give those kinds of solutions a fair shot. Do you have any kind of, I'm asking just because you've worked with them.
So continue to source that place. I don't look good in hats, and I really don't look good in aluminum hats, and I don't believe in black helicopters. And having worked inside the FDA, I can tell you the people that work there, the 11,000 people that work there, are dedicated to the hilt, to the public health. They can believe their jobs, triple their salaries. They're there because they believe in the mission. I believe in the mission. And anybody that thinks that there's some conspiracy inside government to block certain types of medicines, I think needs to, get a life.
Well, that response was very clear. I am so glad that I asked you, because I've read this about, especially since I like to use some natural things. I use a blend. I don't think that our, that the FDA is the devil, or that the government is necessarily the devil. Close to it, but not. I'm just kidding. But I think that, a combination of an approach is good. But you hear some holistic people. I work with one of my holistic doctors that basically thinks the FDA is the devil, and that, there's a cure for everything, and they're just hiding it, and all kinds of crazy things.
Well, people are entitled to their own opinions, but not entitled to their own facts, as they say.
Yeah.
And I believe that if you don't really understand what we're talking about, just keep your mouth shut.
I think you're absolutely right. I think that, one of the advantages or disadvantages, if you will, about having access to so much information via the internet and the media is that there's a lot of false information out there.
That's exactly right. The internet is not necessarily anybody's best source of information. My advice is, if you have solid questions, talk to your doctor, talk to your pharmacist. Pharmacists are tremendous sources of quality information, all of a whole variety of issues. People should take more advantage of that.
I think so too. And in fact, I would argue that the pharmacists many times know more than your doctor does about the drugs that you're taking and things like that.
Doctors really are not pharmacologists, and pharmacists are. So relative to drug-to-drug interactions, or whether you're getting the proper dose, or whether the drug you're taking might be expired or counterfeit or substandard, those are solid questions to discuss with your pharmacist.
Absolutely. I had a little tiff with one of my doctors one time about something that he had prescribed for me. And I asked the pharmacist, and the pharmacist's answer was like completely different than my doctor's answer. And he printed something out and said, "Take this to your doctor, like your doctor's wrong." And he was.
I think it's really important to kind of really engender conversations between patients and pharmacists and physicians. That's a powerful team. And just doing one or the other is okay, but it's not the best we can do. People take care of all of the resources that are available to them. And I really stress pharmacists as being a key part of that conversation.
Yep, I agree with you completely. I have found that to be the experience. Just logically speaking, you gotta figure that they would know more. That they would know more, because that's their field. That's what they specialize in. We're up against a break. We're going to take a quick commercial break. You're listening to Money Talk with Melanie. I'm your business diva, Melanie Klett. My guest this hour is Peter Pitts, and he is telling us, he's the author of Common Sense Medicine. Common Sense Healthcare. I apologize. Common Sense Healthcare. And he's telling us all about how we can get to Common Sense Healthcare, and suggesting some reforms that need to be done. I'm very glad to have him on the show today. We'll be back in a few minutes.
Hey, this is Michael Wright.
And I'm Shannon Wright.
That's For the Way with Shannon Wright. Monday through Thursday from 7 to 9 a.m.
Yep,
Right
so
here
can
on
everybody
SXL
else.
Media.
Why are they joining us?
For fun things like sports, politics,
Oh, maybe some news and entertainment?
and all kinds of other things.
Money and recipes and events? All kinds of stuff.
Yeah, so join us Monday through Thursday 7 to 9 a.m. here on shrmedia.com.
From a public locker inside a dilapidated Long Island rail station comes a show designed to piss off liberals using truth, facts, and ridicule. The Lid Radio Show, featuring the conservative voice from the People's Republic of New York, the Lid himself, Jeff Dunetz. Tune in every Wednesday at 2 p.m. Eastern, 11 a.m. Pacific on the SHR Media Network. Go to shrmedia.com. At Lid Radio, we fight for the truth, justice, and a good kosher T-bone. If you don't listen, Hillary Clinton might sneak into your bedroom in her housecoat late at night and blame you for her election loss. It's the Lid Radio Show with Jeff Dunetz. Hey girls, Carry Girl Gear is here. More and more women every day are concealed carrying, participating in competitive shooting, and keeping firearms straight. It's not boys' club anymore, and we don't have to shop in their stores anymore either. Finally, a cool and unique clothing line just for women. Dope tees and hats for the patriotic concealed carry and 2A girl. So what are you waiting for? Go check out carrygirlgear.com today.
It's your business diva here, Melanie Collette. I am inviting you to a front row seat as I discuss some of the most intriguing details of wealth and finance with today's movers and shakers in the world of business. Listen in and discover financial truths on a global, domestic, and household scale. Uncover topics that will impact your wallet today and in the future. Money Talk with Melanie airs Monday through Friday, 5 p.m. East, 2 p.m. West, right here on SHR Media and High Plains Pundit Talk Radio. You can't afford to miss it.
New show on the SHR Media Network, Sackheads Against Tyranny. On shrmedia.com. Go there quick like a bunny, 11 p.m. Eastern, 8 p.m. Pacific every Wednesday. Live and direct on the SHR Media Network. shrmedia.com. Be there.
Welcome back. You're listening to Money Talk with Melanie. I'm your business diva, Melanie Collette. My guest today is Peter Pitts. He's talking to us about common sense healthcare. Very glad to have him on the show today to talk about these topics. Another thing that I wanted to bring up is about the drugs and about the discounts that never reach the patients. You hear about these huge discounts, and I think you touched on it earlier about how the drugs are so much cheaper in places like Canada and maybe Mexico and places like that. Is there a reason for that?
That's a really good question. You know, different countries reimburse products in different ways. I think maybe a good place to start is to pick up the newspaper and read about a new drug that is for a certain type of cancer, for example. And you see that the drug costs picking up $1 million a year. That's the list price. And $1 million is a lot of money, but then you have to recognize that no one really pays that price. Because if you have private insurance, the insurance companies, the prescription benefit managers negotiate with the manufacturers a 30, 40, sometimes a 50% discount. And yet, those savings aren't always represented in lower copays for the patient, which is terrible because it means that the money that the discounts given, rather than lowering a copay at the pharmacy, for example, are going into the pockets of these middlemen. And it's a great business model because they don't have other than facilitate access. And so what a lot of people are saying is, well, let's give everybody the chance of a fair profit to make sure that a fixed amount of the rebate, 50% or sometimes more, goes towards lowering copays, which is what to most people drug prices mean.
Okay, that makes a lot of sense. I know I've run into situations where I had a client who, as a matter of fact, who was on a cancer drug, and I think she said it cost $1,300 a month. But then her doctor was able to get her the discount through some kind of program. But if she did not have that kind of doctor who was able to help her that way, she would have been kind of left in the lurch. And that's
That's
just
right.
go,
That's right. Another thing is that the copay is oftentimes based on the list price of the drug rather than the price that the insurance company has negotiated. So they're trying to have it both ways, both getting a bigger discount in pocket, but then keeping the copay high based on the list price. That's to me just dishonest and probably close to stealing.
now, is there? I suppose that there's something that legislators should be able to do about that.
Well, there are a couple of things. So this is illegal because of what's called the safe harbor rule. So you have to ask yourself, when does a rebate become a bribe or a kickback? And the answer is when the government says it is. So the Trump administration had played around with, what I think is a very sound policy of doing away with that safe harbor, forcing companies to play fairly as opposed to hiding behind this new rule, but they backed off, unfortunately. The one thing that they did do is, you're not going to believe this. When you walk into the pharmacy, sometimes because of the weird way our healthcare pricing system is structured, it's cheaper to pay cash than to use your insurance.
Yes.
But for years, there's something called the gag rule that made it illegal, not impractical, but illegal for pharmacists to tell you that. And what the government has done in the past few months is say, no, if it's cheaper for you to buy the product through cash, the pharmacist should be allowed to tell you that. So these gag rules are slowly falling by the wayside as they should. So all of a sudden, and again, it's empowering the pharmacists to help their patients, their customers, have access to products through the cheapest means available.
Wow, that's horrible. That's just horrific. And I know you have to go in a couple of minutes. So before we go, I want to make sure you're able to tell the audience where they can pick up your book.
Well, thanks so much for asking. Again, it's called Common Sense Healthcare for Common Sense Americans. It's available on Amazon, obviously, or at our website, which is cmpi.org. And I urge you to have a look at it, because what I say in this book is, if you're talking to a political candidate and they can't explain to you how their plans for healthcare protects innovation, you should really ask a lot of questions. And then give them a copy of my book, and I'll pay for it.
Excellent. Excellent. I love it. Thank you so much for being on the show. I appreciate it.
My pleasure. Good conversation, and congratulations on your recent electoral victories.
Thank you. Thank you. It was a great time. Lots of hard work. I appreciate it. I hope you'll come back.
Thanks very much.
All right. Thanks. You're listening to Money Talk with Melanie. I'm your business diva, Melanie Collette. That was Peter Pitts, ladies and gentlemen, who was talking to us today about common sense healthcare. I hope unfortunately, he was traveling, so the sound was not as great as I would have liked it to be, but hopefully you got the gist of what he was trying to communicate to all of us. Some very good information there. And hey, buy his book, Common Sense Healthcare. It's available on Amazon, as he said. You should check that out. And I want to thank you guys so much for being here. Thank everybody in the Facey chat. And if you're listening to this via a download, thank you very much for listening via download on iTunes and any other modes of podcasts that you can listen to. And we'll be back next week with another wonderful guest. Just an FYI, a couple of weeks ago, I was at the National Publicity Summit, and one of the things that I'm able to do there is have access to all of these wonderful guests and people that want to be on the show. And so I have a whole bunch of really cool guests coming up. So I hope that you're going to join me Fridays at 5 o'clock for Money Talk with Melanie. Remember, this is very important because after all, it's your money. Have a great weekend.